And watching out for you tonight, the medical director of UCHealth Memorial told reporters today the growing number of COVID patients in our community is putting a strain on their resources right now. News 5's Andy Cohen continues our coverage live tonight with a closer look at how they're dealing with this challenge. Andy?
Yeah, Rob, the hospital has a surge plan in place, which essentially means they've already identified the staff and the facilities that they can reassign so that they can increase their bed capacity as more patients come in with more severe symptoms of COVID-19. But the real concern tonight is the continued growth of the virus in the community that could lead to more negative consequences in the future. The doctors and nurses at UCHealth Memorial are caring for more COVID patients than ever before.
The hospital is extremely full. There was one day our census was like 111%.
Today's numbers are well above levels set in March and April during the lockdown, a lockdown that negatively impacted people's health.
One of the things we saw early on in the pandemic in the spring was people were afraid to come to the emergency department. And as a result, heart attacks happened that they missed. People ended up having ruptured appendicitis. People ended up having diseases that progressed to a point where it's much harder to treat.
So today they're doing it all, and it's getting crowded.
We're going to have to think hard about how we can decrease the flood of COVID patients coming into our hospital. And the only way that we can do that is to stop the transmission rate broadly.
They are fully stocked with personal protective equipment, and the hospital staff remains healthy, but the number of positive virus tests keep growing in the community, and it's raising alarm about more serious outcomes.
Remember, it's not just today, but I have to think about what's about to come through the door, and I look at how many people are sitting in the emergency department and then anticipate what tomorrow looks like.
He says everyone needs to do their part to slow the spread of the virus.
One of the reasons we're asking people to put on the mask, socially distance, and take this to heart is that we need to protect our workforce so that we can take care of you.
And the hospital did recently change its policy when it comes to visitors. It used to be 2 people per patient. It's down to 1 right now. They really want to limit exposure about who's coming and going from the hospital. They recommend that you check in before you come to visit so that you know what the most up-to-date policy is. Rob?
And Andy, what plans are in place if the hospital is overwhelmed by the number of patients coming in with COVID symptoms in particular?
Yeah, Rob, we really hope it doesn't get to that. However, the Dr. Steinbrunner said that he's aware that the medical director in El Paso County has been working on a plan for an alternative care site, either here in El Paso County or perhaps in discussions with Pueblo County to use the alternative care site that's been set up at St. Mary Corwin Hospital. Always watching out for you, Andy Cohen, News 5.